Hi, this is Dr. Fodero. I'm a board-certified plastic surgeon, and today we're going to be talking about rhinoplasty. So this is one of my patients. She's a very pleasant 19-year-old female who doesn't like the appearance of her nose. And her only real concern is the bump. She likes the way her nose looks like from the front. So when she came to see me, we took these set of pictures. So this is her from the front, and she's very pretty. And there's really nothing wrong with these views. And so we don't want to change that. As we start to move around her and we look at her from an angle, this is the oblique view, you can see the prominence of her bridge. And this is really the area that concerns her. And then finally, when we look at her on the side view or the profile view, this is why she's in the office. She just doesn't like this bump. So in her case, the goal is to fix what she doesn't like and leave everything else alone. So it's not just to reduce the bridge, it's to leave the other parts of the nose untouched. So in her case, what I did is I gently removed the bump by taking down some of the bone and cartilage and then gently repositioning the bones after re-breaking the nose or doing osteotomies. And so we can see after the surgery, here she is from the front, and you can't really see the reduction in the bump, but you can see that we haven't changed the lower portion of her nose. So sometimes it's important what you do and it's important what you don't do. So in her case, we didn't change the way her nose looks like from the front. Maybe we did a little bit of narrowing in here, which I think improves the general aesthetics of her nose, but we didn't make radical change from the front. And then when you look at her from the oblique or from the side, you can see that the bridge is nice and smooth. It flows gently into the tip of her nose and everything is in better balance. So I think this is a much prettier nose. And then finally, if you look at her profile is perfect and she's very happy with this because that bump that was causing her concern is now gone and the tip and the bridge of the nose is now straight and it blends with the tip seamlessly. So this is a very nice rhinoplasty. She's very happy with the result. This rhinoplasty was done in a closed fashion. The operation took approximately an hour and a half. I removed her cast after 6 days, and after 6 days, she was ready to return to school or work.